Hey, oncology advocates! Ever cared for a patient with painless lymph node swelling, night sweats, and weight loss, and the labs came back with more than just infection? You may be dealing with lymphoma, a blood cancer that begins in the immune system and often presents subtly before progressing rapidly. Today we're unpacking what lymphoma is, how to recognize it, how it's treated, and what nurses can do to support patients through their journey. What is lymphoma? Lymphoma is a cancer of the lymphatic system where abnormal white blood cells, usually B or T lymphocytes, grow uncontrollably in the lymph nodes and lymph tissues. There are two main types: Hodgkin lymphoma, HL, which is characterized by Reed-Sternberg cells, typically spreads in a predictable, contiguous pattern, often affects younger adults, ages 15-35. Non-Hodgkin lymphoma, NHL, which are more common and more variable, includes aggressive and indolent subtypes, can originate in lymph nodes, spleen, bone marrow, GI tract, and more. Common signs and symptoms. Classic lymphoma symptoms include painless, firm lymphadenopathy, especially neck, axilla, groin, fever without infection, night sweats, unintentional weight loss, 10% in 6 months, fatigue and weakness, itchy skin or alcohol-induced lymph node pain, Hodgkin specific. These are known as B symptoms used to stage the disease and assess severity. Diagnosis and workup: lymph node biopsy confirms diagnosis and type. CBC and LDH levels assess organ function and tumor burden. PET-CT scans determine spread and staging. Bone marrow biopsy, especially in advanced or high-grade NHL. Treatment options include chemotherapy, ABVD regimen for Hodgkin, R-CHOP or other regimens for non-Hodgkin, radiation therapy, often used in localized disease, targeted therapy and immunotherapy, monoclonal antibodies such as rituximab for B-cell NHL, stem cell transplant for relapsed or high-risk cases, CAR T-cell therapy emerging in aggressive forms of NHL. Nursing priorities include monitor for treatment side effects, myelosuppression, watch WBC, platelets and hemoglobin, nausea, mucositis, and neuropathy, monitor for tumor lysis syndrome in aggressive disease, prevent infection, implement neutropenic precautions, educate patients about hygiene, masks, and dietary restrictions, support nutrition and energy, encourage small, frequent meals, monitor for cachexia or malnutrition, address fatigue and encourage energy conservation, emotional and psychosocial support, validate fears around diagnosis, hair loss, and fertility, offer resources for young adults with cancer, encourage peer support and survivorship programs. Bottom line, detect early, care deeply, treat as a team. Lymphoma might start in the immune system, but it impacts the whole person. As nurses, we support not just survival, but quality of life. What's one thing you always teach patients starting lymphoma treatment? Share it in the comments. Like, subscribe, and follow for more oncology care insights, because early detection and compassionate care go hand in hand. And remember, recognize, respond, reinforce hope.